Please start.
Dr. Prakash and then other people who are presenting the zoonosis and zoonotic and miscellaneous group, part 2. The part 1 was supposed to be done by other people. They will be doing it next week. Yeah. And the group members are Dr. Prakash and Dr. Nayan Jyoti Sarma, Anshureka Das, Dr. Atanu Chakrabarti, Dr. Lakshmi Narayana Yase, Dr. C. Nagaraj, and Dr. Nella Harshini. These are group members, and Dr. C. Nagaraj was supposed to present by some inconvenience, sorry for that, and we'll go ahead with the competencies. Our first competency was 8.9, that is a competency. Discuss the appropriate method of collection of samples in the performance of laboratory tests in the detection of microbial agents causing infectious diseases. So the suggested teaching learning method is lecture and small group discussion. The domain is knows and the level is knows how. So the suggested assessment method is written or viva voce. So this competency was divided into SLOs. So we have divided into 10 SLOs. One is discuss the method of blood collection for culture, and the second SLO is discuss the method for sputum collection for culture, and third is discuss the method for urine culture collection for culture. Then discuss the method of wound swab collection, and discuss the method of collection of throat swab. Then discuss the method of collection of vaginal swabs. Discuss the collection of CSF. Discuss the method of collection of fluids from sterile sites. Then discuss the method of collection of skin scrapings, nail clippings, hair root for the fungal infections, and discuss the instructions given to patient before collecting specimens. These are all the 10 SLOs. You would like to introduce them before in a lecture class, 1 or 2 lecture hours, and then we are going to have a case discussion wise, or we are going to ask them to do a small group discussion with this. Then we have an 8.10, it's a core competency, and we demonstrate the appropriate method of collection of samples in the performance of laboratory tests in the detection of microbial agents causing infectious diseases. So there we have told them the theory and the small group discussion. So that same thing, the teaching learning method here is DOPS. DOPS is going to be the teaching learning method here. So they have to show how they are going to do that. So whatever they have learned and discussed in the first 8.9 competency, they have to show it how they are going to do it here. So the level is shows how. So this can be performed in the practical classes where we are going to assess them how they are going to collect, either using OSPI. So the competencies are divided into SLOs. Demonstrate independently the method of blood collection for culture. So they have to draw the blood and then show us, and then demonstrate independently the method for blood collection for serology. Then demonstrate independently the method of collecting throat swab. Demonstrate independently the method of collecting wound swab, and demonstrate independently the method of collecting skin scrapings. These are some of the SLOs what we have developed for this competency, and which will be done in the as a DOPS during the practical hours. So then this can be also assessed using the auspice, how exactly, and then we can do that. Next, coming to the 8.11, the core competency is demonstrate respect for patient samples sent to the laboratory for performance of laboratory tests in the detection of microbial agents causing infectious diseases. Again, this is a DOP session. The domain is affective. This is the one session where their affective is being shown, whereas others all we have seen it is all cognitive and psychomotor, and this has an affective one. Its level is shows how. So again we are going to assess by skill assessment.
Hello.
So the
hello.
Yes, sir.
Dr. Nagaraj has also joined now.
Yes, sir. If you want to continue, you can continue, sir.
Okay.
Yes, sir.
So I'm making him.
Yes.
Hello.
Yes, sir. Yes, sir.
Sir, please share screen.
Yes, sir.
Yes. We can see your screen. Just open the PowerPoint.
PowerPoint, no, sir? Okay, sir.
Yes.
So we are sorry for the delay in my connections. Dr. Prakash was discussing about the, now we have come to the 8.11.
Yes, sir.
Yeah, thank you, Prakash.
Thank you,
Sorry
sir.
for
Thank you,
the
sir.
delay in my joining. 8.11 again is a core competency, and the competency level is actually we have to, it is affective domain where we are going to use, we have to demonstrate respect of our patient samples sent to the laboratory for performance of laboratory tests in the detection of microbial agents causing infectious diseases. Is a effective domain, and it shows how will be the level of competency, and suggested teaching learning method would be that is a DOAP or role play, and suggested method is skill assessment, and here we choose a correct container. Actually the student independently will be able to correctly collect the container to use for a sample like blood, urine, sputum, pus, whatever sample we just ask, he has to pick up from the group of the material that is being kept, then demonstrate how to pack the specimen for transportation. Before transportation, he should also know the level, the labeling of it, verifying the identifiers or the patient identifiers, pick up appropriate packing material, and he has to keep in a cool pack whenever it has to be transported. And the PPE he wears, he will be in a position to demonstrate all these things, discuss the information or informations that shall be written in the request form. So the patient identifiers, samples with request, appropriateness of the test required has to be in the information that has to be provided to the laboratory. All those things before packing, the student should be able to discuss all these things, information, and discuss the storage methods that has to be used in case of delay in transportation. Example, CSF, they are not supposed to refrigerate. He has to know about that. On the other hand, blood and serum, they have to be actually stored at 2 to 8 degrees. This type of competency, the student will be able to discuss. So this is the affective domain which we will be doing, and in the class also we can arrange these things for them to do with the help of a role play and things like that. It helps a student to develop competency in this particular aspect. Coming to 8.12, is again a core competency. Here he discussed the confidentiality pertaining to patient identity in the laboratory results. Very, very important. And the teaching learning method will be either a lecture or a small group discussion. Small group learning, it will be there, and the domain will be knowledge, and the level would be know-how.
मतलब यहाँ पर भी ना वही thesis करने वाले हैं, so I wanted some.
Yes, sir. Suggested assessment method will be Viva. That will be the thing in the examination. He has to tell all these things, discuss the confidentiality. So in this, the SLOs would be, he should be able to define what is confidentiality, discuss the rights and responsibility of the patient. Very important. Unless he knows, the confidentiality will not be able to be discussed. And he has to discuss about the rights and responsibility of the laboratory with respect to confidentiality, how the laboratory has to maintain the confidentiality of the patient, because it's a contract between the patient and the laboratory which conducts the test. So this interaction, the student should be able to understand and able to discuss about this. Then able to discuss the ethical issues involved in the confidentiality pertaining to patient identity. Well, there are ethical issues which has to know about it, especially in the current scenario. These are all very, very important, and this has to be maintained. And this also can be discussed with some of the, we can also give some case studies for the students to talk about the confidentiality, and this will come in the next part of the competency. The next core competency would be 8.13, and here the competency will be to choose the appropriate laboratory test in the diagnosis of the infectious disease. So the suggested learning method will be small group discussion or case discussions. So the domain will be knows and the level would be knows how. The suggested assessment method would be written VIVA-OC or OSPI. So the student will be have to know much more important things and the question of lab diagnosis and appropriate tests, what he is going to advise when he becomes a person who asks the laboratory to talk about the competency. So for this, the competency under this, the student will be able to identify the clinical condition based on the history provided. The clinical condition, example, fever, upper respiratory infection, lower respiratory infection, urinary tract infection, then genitourinary, unconscious patient, etc. could be the conditions on which the student can be given case-based exercises, and he'll have to identify the appropriateness of the test, and that's how he can be evaluated. And he also has to choose the sorry.
Please go ahead with.
Yeah. Then coming to the next core competency, 8.14. Here the competency is again a core competency to demonstrate confidentiality pertaining to patient identity in laboratory results. See, suggested teaching learning method would be DOP or role play. And the affected domain will be affective domain. So he has to be able to show how. That will be the level of competency, and suggested assessment method would be the skill assessment of the student. So he has to choose the infectious disease, appropriate laboratory test for the diagnosis of the infectious disease. The next core competency is, I was telling about this, role play or DOP for the demonstration of this competency. Here the affective domain is there, and he shows how, and the skill assessment has to be done by the student. That will be assessment by in the examination. So here the competency would be taking a student will be able to take an example of a case of HIV or sexually transmitted diseases, lymphatic filariasis, tuberculosis, and try to discuss about the legal and social responsibility and how the legality and he has to demonstrate the confidentiality pertaining to patient identity in the laboratory results, and how to actually counsel the patient before and after the examination, and how confidentiality has to be maintained in the laboratory has to be demonstrated. He has to demonstrate the understanding of importance of confidentiality and counsel the patient about the test result. When the patient asks for the test result, he should be in a position to discuss what the test has been done. Before the test has been done, he should be clearly explained why the test has been done, what are the things that we are going to do it, and he had to, after the results come, the patient, when he has got every right to know about the test results and what the situation is there, but maintaining the confidentiality to the patient, these have to be divulged, and this training has to be given to the students. The next core competency would be 8.15. Here he has to choose and interpret the results of the laboratory test used in the diagnosis of infectious disease. I think here most of the infectious disease which we have been discussing all through will come into the picture, and the teaching learning method would be small group discussion and case discussions, and the domain will be knows and shows. Both will be that will be the domain, and level of competency would be shows how, and suggested assessment method would be written, VIVA, and OSPI. We can give case studies and have a discussion so that the student is well prepared for going into the clinical side. He has to choose the appropriateness of the test, laboratory test in the diagnosis of an infectious disease based on the case scenario. Case scenario can be any of the infectious disease that will be asked, or he'll be trained in, and he'll be able to discuss and tell why appropriateness of the lab test that is required, and he'll be in a position to discuss the test that has to be requested, and also about the results. He'll be able to know about that, why the particular test has been done. So that will be the thing, and he'll be in a position to interpret the results of the laboratory test used in the diagnosis of infectious disease. This must be the competency the student should have at the end of this session. The next session would be another important thing. We are all this 8.9 to 8.15, we discussed about infectious disease. These are all taken into the next level in the 8.16, where national programs, health programs are to be discussed. So describe the national health programs in prevention of common infectious disease for information purpose of only to as a taught in the, most of the things will be taught in the community medicine, but we have to actually expose the students for the different national programs. See, national programs are very, very important, and students should be able to do the things. And this as the teaching learning method would be through the lectures, where each of the program that will be discussed, and the domain will be knows, and level also knows. So cognitive is a main this one that will be tested, and suggested assessment method will be written or viva. So the competency that a student should develop would be list out all various national health programs in the prevention of common infectious diseases and describe the goals of various national programs in the prevention of common infectious disease. So this is one of the most important part of the entire syllabus that we are discussing all through. From day one we started the course, and I would like to say that this finally comes to an end of the whole thing out, where both the infectious disease diagnosis and competency regarding national programs are discussed. So this is what is a part of discussion. So I will stop at this, and we can go for the further discussion. I thank Dr. Bedi, Sanjay Bedi, as well as the other Bedi, and then also I thank Dr. Prakash. All these people have helped, and our group for making this presentation possible, and we are in a position to talk about this. This is just a list of national programs. I would just try to introduce that we have got bacterial infection, revised national TB program, RNTCP, leprosy eradication program, we have got national rabies control program, we have got then prevention and control of leptospirosis, then plague eradication program, this is the regional one, and YAS was there, but we have eliminated some of these things that has to be told. Then national vector-borne disease control program, 6 major diseases are discussed under this national vector control program, like malaria, Kala Azar, then lymphatic filariasis, dengue, and Japanese encephalitis, and chikungunya. Then NACO is already there with the AIDS and AIDS control program, national AIDS program, and we had other programs which are there as part of it, and which are in the development. So all these things will come, and I think that we also could think, my last submission before I conclude my presentation would be that we also should include a topic on safety practices in the laboratory, and if classified, and we'll have to actually this last part I'll just leave it up, because this will come in our further discussions. Thank you, sir. Thank you very much.
Thank you very much, Dr. Nagaraj. It was a wonderful presentation, and
Thank you, sir.
the group work was excellent, right? Once again, we are sorry for the inconvenience caused because of some technical issue, because we are allowing different group leaders to present their view. So many of the group leaders are still not able to cope up with the techniques, right? So it happens when they are presenting for the first time, technical issues do come. So I think we are sorry for that inconvenience caused, but the group has presented very well. They have, I think, extracted SLOs in a finest way out. One suggestion, or one thing which I'd like to add is that
Yes, sir.
when we have got a performance,
Yes, sir.
one as a psychomotor and one
Yes, sir.
performance as an affective domain, right? These two things are different.
Yes, sir.
So, as for example, if we are talking about affective domain, the base would be the role play, right?
Yes, sir.
Once
sir.
again, it can be performed in a small group learning only. And when it
Yes.
is psychomotor, as for example, gram staining, then the
Yes.
dope would be ideal method, right?
Yes, sir.
So in one of the SLO in which it has been described, I think it is independent performance. If you can, we can go to that particular slide. Students should be able to perform independently. If you can please go to that slide.
Yes, sir. I'll just go, sir.
Okay, over here, right? Yes, yes, it was there.
Yes, sir.
That SLO.
Yes, sir. I'll just go, sir.
Not this one.
Oh, back, sir. Yes, sir.
Yes, yes. Okay. This was
Yes.
demonstrate independently that SLO.
Yes, sir. Yes, sir.
Okay, yes, this slide, right? So
Yes.
we have been preparing a SLO, but when we talk about such type of performance over here, students is supposed to do that, right?
Yes, sir.
So over here, SLO needs to be very specific, and we
Yes, sir.
need to include all component of SLO. Otherwise, it will not be possible for our staff members to organize this particular teaching session, right? We are
Sure,
talking
sir.
that students should be able to demonstrate independently the method of blood collection for culture, right?
Yes, sir.
Usually when we talk about independently, that means student is going to perform such type of thing and not under any type of supervision, right?
Correct, sir.
Okay, that is usually for higher skills, for a higher level. But if
Yes,
we
sir.
talk about this one in microbiology, they should be able to perform this, and we have to put some conditions over here, right?
Sure, sir.
Because as for example, we can put a mannequin over here in a provided mannequin,
Yes, sir.
or an
Yes.
artificial patient, right? Like that condition is very important. So that will help our
Yes.
staff members that what they are supposed to do for this particular session, right? So
Yes, sir.
this is the one thing.
I'll
Otherwise,
add,
most of the
excuse me, sir.
yes.
Yes, sir. Sir, one blood smear collection also should be added here, sir.
Okay, yes, that can be done. But as for example, when we talk about human
Many things
beings,
I have to answer. Yes.
yes,
Sorry
collection
for
of blood, and yes,
Yeah.
that for that we need to put a mannequin. Now
Yes, sir.
you can divide into multiple sessions. Those all performance which can be performed on mannequin, and then if
Yes, sir.
it is blood, you can bring blood, right? Over here,
Yes, sir.
mannequin is not required, right? Like that.
Correct.
So only few specifications need to be added. For cognitive, it is not that much required, but for psychomotor and affective domain, that all component of SLO, A, B, C, D needs to be put in. That will help our staff members to
Organize it.
arrange the session. That is very good. Otherwise, all SLOs are very good, but we can still further improve, and we can put some of the rather make it still better. Otherwise, I think it is a very good work done by the team. I really appreciate. I think we can invite a suggestion from the members, participants. I think probably we started little bit late, so I don't see any hands being raised. So by the time if somebody is there in for asking question, I once again congratulate you, sir, for taking initiative for zoonosis 1. Rather, it is only that part is zoonosis.
Yes,
What
sir.
you said, this part 2 is the name is totally different. Actually, in competency, it is zoonosis and miscellaneous thing.
Correct, sir.
Yeah, so definitely we can name it. So one thing you can do, sir, with your team, you can
Yes,
put
sir.
all the SLO in that Google sheet, right? So all
Yes,
will
sir.
be able to use that. You can
Sure,
also
sir.
mail me this PowerPoint, so I'll be putting in the Google Classroom, so everybody can also have access to that, right?
Sure, sir.
And with regards to that zoonosis part 1, there are
Yes, sir.
some of the members, they are already working. I think 2 persons are working. You
Yes,
have
sir.
taken the lead, and I will
Yes.
also be working along with you. So if
Sure,
possible,
sir.
either next Tuesday, or if possible, we can also shift to next Saturday, because
Yes, sir.
if we'll be able to complete that, we can take it on Tuesday, or we'll be able to take it on Saturday for
Saturday.
definitely, right? That would be great.
So let me
So
first thank you, Dr. Sanjay Bedi and Dr. Prakash, personally, for all the support you people have given me for preparing the whole thing out. As a group, we were able to put up this presentation, sir. Thank you, sir.
oh, welcome. Actually, all group leaders needs, I think, needs to be recognized, because they have done a wonderful work.
Yes, sir.
And
Yes.
otherwise, this many competencies and breaking down into SLO would be a Herculean task. And this is being done by the different group members, and they are presenting their view. So all of the members, we are having a lot, we can say a complete list of all SLOs, which we can accept, which can revise, and which we can implement. So definitely it is all a teamwork which we are achieving. So let us see, is there anyone? I don't see any hands. Probably it is too late. So if there are no hands, Dr. Prakash, would you like to say something?
Hello, sir. Yes, sir.
Yes, yes.
It was a nice presentation by Dr. Nagaraj, sir. Actually, we try to implement all the things, but there are some minor corrections which needs to be done, sir. We will try to implement that and then send it to you, sir.
It was a wonderful work, sir. It was a wonderful work. We all,
thank you, sir.
yes, definitely. We all will together will improve all the SLOs, right? And we'll make
Yes,
a
sir.
perfect list of SLOs. Yes.
Yes, sir. Yes, sir. Sure, sir. We will do that, sir.
Thank you very much, sir.
Oh, welcome. Dr. Bedi? I think we can end the session over here. It is 7, and we don't see any hand raised. So Dr. Sanjay Bedi? Probably,
Yes.
I think,
Yes. Yes. Actually, I was on the other webinar also.
Okay. So I think because it is late, I don't see any hands being raised. So we can end the session over here.
Okay.
Congratulations.
There is one Dr. Kishore. Dr. Kishore Anime Reddy has raised his hand.
Okay. So let her say some whatever suggestion she has got.
Yes, Dr. Kishore, please unmute. Dr.
Hello.
Meena Bhalla has also raised.
Hello.
Okay.
Yes.
Good evening, sir. Myself, Dr. Kishore. Can you hear my voice, sir?
Yes.
Yeah. Good evening, Dr. Nagaraj, sir. It's me, myself, Dr. Kishore, sir. It's a good presentation.
Sir. Nice hearing your voice.
Yes, sir. Sir, regarding one thing, confidentiality, competency, can I just see back the confidentiality of reporting?
Yes, sir.
Rights and yes, sir. Yes, sir. Yeah.
I'll go to the SLO, sir.
Yeah, no, sir. This actually can be made as a role play and also a video demonstration also can be done. I think
I agree with you, sir.
it has been made as a small group teaching, something like that. But a
Yes,
role
sir.
play will be a better option so that students will have good interaction.
Definitely.
Yes, sir.
And
You are
video demonstrations.
Sir, you are very right, but there are two competencies which are in sequence. The first one is talking about the cognitive aspect, and second one is talking about affective aspect. So in another one, they have prepared them. Yes.
Because these are the questions where we get in EdCom actually.
Yes, yes, you are very right. It is. We are not saying no, but there are
Yes.
two competencies about confidentiality. One is
Yeah,
talking
yeah,
about
sure.
cognitive aspect in which you are supposed to tell them the right and responsibility and legality, and in second
Yes.
you tell them to perform. That is very right, in which role play is very important. That is what we talked about. Yes, yes.
Yes, yes. Thank you, sir. That's all.
Dr. Ranjani.
Good evening, sir. Thank you, sir. Good evening, Dr. Nagraj.
Good
Wonderful
evening, ma'am.
presentation.
Thank
So,
you.
this is for my understanding. Regarding 8.15, choose and interpret the lab test. Like, how should one break it down? This is for me to understand, like, because it's almost the whole of microbiology. So, how
Yeah.
does one go about teaching this? How to break this down further? I just wanted some guidance in it.
What I was feeling myself personally is that, see, when we discussed about systemic diseases, we discussed in detail regarding the laboratory tests. The
Yes,
whole
sir.
thing can come here, and we can
Yes, sir.
elaborate at this particular point of thing, which can go parallelly, because this totally goes into the practical aspect of it. This is my personal view, madam. This
Yes.
is how we have to go in the theory part of it, where you have discussed. The practical aspects have to be brought in here, because most of the infectious diseases, whatever we are discussing in microbiology, is all infectious disease.
Okay. So,
So
how
there
much time would we give, sir?
we have to go by the etiological agent like bacterial infections, then viral, parasitic, like that. We can divide the whole thing out. Second thing is we can broadly bring down, and when you are telling in the theory aspects of it, we can actually try to relate it to what are the important thing for a diagnosis, where we have put the selection of tests when it comes to the SOPs that we have done it now, SLOs. That is
Should we keep this competency at the end of all our other sessions then, after we have finished all the
Yes,
terms?
yes, madam. I would like to just say one thing. This will
Yes,
be in
sir.
the last. This will be in the last semester, right? Last term.
Okay, okay, sir.
After teaching them all clinical different
Hello.
systems, you'll have
Okay,
to
sir.
put some of the sessions like that, in which you put a clinical cases of tuberculosis, syphilis, urinary
Okay.
tract infection, and other infections, right? It will be,
One for each system, sir.
yeah, we have already taught them, right, in different systems,
Okay,
and this will be
okay,
the last. Yes,
okay. Thank you, sir. Thank you so much.
welcome.
Hello.
Dr. Mukesh Kumar.
Yeah, hello. Hello.
Yes, we can hear you.
Yes.
Yes, we can.
Yeah, Dr. Mukesh here. Good evening, sir. Sir, I would like to add on the ma'am's question that how they can interpret. Ma'am, this one we can go with the case-based teaching, ma'am. So whenever as you told that the case scenario should be given, like what the most commonest case scenario, and that will put group discussion, will just float it in the group and just moderate. So there we can help them to come to how the decide which test to be done and what possibilities are there. This can be done.
Yes, you are very right. This is what they have done, right? You can see over here, it is a small group discussion, and that is based on a case. Yes, you are very right, sir.
Hello.
Yes. Dr. Mukesh.
Yes, sir.
Here your suggestion is very well taken.
Sir.
Yes. And this
Thank
is
you,
what
sir.
the
Thank
group
you.
has presented. Yes, this is what the group has presented. That is teaching learning method is a case discussion, and that will be in a small
Yes.
group. Small group learning.
Yes, sir.
Yeah. Different
Because
cases
also
to
we
be.
are doing in the practical also, like that will give the small case, and then we'll ask 5 or 6 SOLOs, we will discuss with them like that.
Yes. That is the
So
only
that they
method
can-
which can be done. Yes, that is the only method which
Yes.
can be done. Yes.
Yes, sir. Yes. Thanks.
Is there anyone else remaining? Dr.
Dr. Sai Leela.
Dr. Sai Leela. Madam.
Yes, please speak, Dr. Sai Leela.
When Dr.
She has
Preena was there,
written. We can't hear you. She has written in the chat box, specimen collection part is only recollection from general microbiology, need not be repeated.
Yeah, definitely. When we once again compile the total teaching hours, lecture and everything, those things which are being repeated, and that needs to be once again reduced down. Definitely. Yes. Dr. Preena, I can't see Dr. Preena. I think she must have left. She was over here.
Yes, she was there, but she has now offline.
Okay. So we don't have any hand right now, I think. So
Yes.
okay. I think we can call it a day, sir. Yeah.
Yes.
Okay. Thank you, Dr. Nagaraj and team, for a wonderful presentation. And once again, we regret for the delay in starting the seminar, right? Let me know.
Thank you very much,
goodbye.
sir. The
Goodbye.
mistake was on my part because I tried to do it. Somehow there was some technical error that came up, sir. Thank you, sir.
Oh, it's all right. That all happens. Thank you, sir. Goodbye.
Good guys, sir. Thank you, sir. Good night.